Bom dia a todos. Essa é a sessão do Inovation.
Good morning. This is the International Immunobiological Symposium. This goes through all 3 days of the event. During the first day, the opening will be done by our Vice President, Marco Kriga, and then we will have the presentation of the Vice Presidency of Technological Management in Biomanguinhos. In the next days, we will have the presentation of the assets of Biomanguinhos. The opening will be by the Vice Director of Technological Management. And then we will have the presentation about the assets on animal experimentation. Then we will have the presentation on the assets of our pilot plant and the advisory on clinical research. So I'm going to present our Vice President, Marco Krieger. He has a bachelor's in biological sciences from the University of Paraná, a master's from the Federal University of Rio, and biological sciences also from the Federal University of Rio. Please. Well, good morning to everyone. I am here with this important mission of presenting Fiocruz as an innovation model. I think it's very important to have this opportunity to show and to speak about what innovation means to Fiocruz. I brought a presentation about our founding DNA. Fiocruz was founded 120 years ago. We will be celebrating this next year with the objective of facing a dramatic health situation. The ports of Santos and especially Rio de Janeiro were facing outbreaks, yellow fever outbreaks, bucolic plague, and Oswaldo Cruz and his colleagues in 10 years were able to control these serious outbreaks. It was not so simple. There was some controversy relating the methods that were used. We even had a situation in 1904, which was the vaccination war. The population rebels against the methods used at that time. But in 1907, with a new outbreak, the population gets in line to receive these vaccinations, and in 1909, Oswaldo Cruz is received in the port of Rio, and I always joke, he was received as if he had won the World Cup. He was a national hero because in those 10 years he was able to face and defeat this health situation. So Fiocruz is not the beginning of scientific activity in Brazil, but it's the first time that society realizes the benefits of the use of scientific knowledge. So this is our mantra, the use of scientific knowledge to benefit public health. And this is what innovation means to Fiocruz in all of its areas. We have an ecosystem that is complete and unique in the world in relation to the chain of innovation. I'm just going to speak of some of the areas that we work on. We work on basic research up until industrial activities and supplying products to our universal health system. So this goes from development, clinical trials, scale up, production, and various areas that we are active in. I'm just going to speak of a few, but here are some important numbers. We are very proud of having about 12,000 employees. More than 10% have doctorate degrees. Fiocruz besides its presence here in Rio de Janeiro, where our historical headquarters is located and our technical scientific units, it is also distributed in Brazil and other states. And this is important because this allows the national system, the system of technology, to be in contact with different realities that are present in a country with continental dimensions like Brazil. So just to show you, if you take Russia out of Europe, all of the other European countries fit in Brazil and you still have some free space. So besides our national presence, Fiocruz has an important role in the field of global health. For example, we are members of important boards and associations like DADI, like FIND. We are a hub as well for interactions between countries that are Portuguese speakers. We are an institute that we're not the Pasteur institution, but we are part of this network. And we also have a variety of scientific collaborations that our researchers engage in around the globe. And so just to look at this innovation chain and how it works, we have a few examples of important achievements by our researchers. For example, in this same decade that Oswaldo Cruz and our colleagues were facing the sanitary situation in Rio de Janeiro and Santos, in 1909, Carlos Chagas creates a publication that is considered the most complete in the biomedical field. So he creates this text about a new disease regarding its vector and the clinical manifestations. And we look at this over time. There are a variety of contributions in the field of knowledge by our researchers. Here is the case of the outbreak of Zika, where Dr. Celina Toshi was one of the responsible researchers for creating this association and looking at the infection by the Zika virus. She was indicated by Dr. Tom Friedman, who was the president of the Center for Disease Control and Prevention, the CDC, in Atlanta, and was chosen by the Time magazine as one of the 100 most important people for this contribution. There were two Brazilians on the list at that time. One was Celina and the other was Neymar, the soccer player. But Neymar did not win the World Cup, and Celina created a great contribution for knowledge. In the same way that we act since the beginning of the previous century in the area of research with great contributions, in the production field we also have great activity, and it's almost been 100 years since we've been active in this. So we have a variety of serums here, and our colleagues in this photo are working in manufacturing and finishing the yellow fever vaccination at that time. But it's important to show that Fiocruz is still giving answers to Brazilian society. Right after our Zika outbreak, we had a new yellow fever outbreak that was very serious, and Fiocruz with Biomanguinhos was able to increase the production of about 25 million doses to 77 million, and this is fundamental for the government to be able to elaborate a contention plan through massive vaccination. So I'm just going to speak very quickly about our complex and the innovation chain and our institutional growth. You can see this in the publications, where we have our index publications in the last 36 years, where we only had about 10 publications until 2018, where there were more than 1,000 publications index publications in newspapers, and about 40% have great impact. Regarding the scale up, we can mention a great advance, which was led by Biomanguinhos, and it's the first pilot plant for biopharmaceutical products and vaccinations. It's in a pre-operational phase and will allow us in the future, in the near future, to produce the molecules that were developed by our teams at Fiocruz. But beyond that, in Brazil as a whole, if one of you will present a molecule, for example, that has the cure for cancer, we could not produce these clinical lots in Brazil. We would have to hire another location, but Biomanguinhos will fill this gap soon. Regarding clinical trials, Fiocruz has this in both of its hospitals and different labs, and this allows us to conduct many clinical trials, but I'd like to highlight a few clinical trials that are being done with technologies that were developed or improved at Fiocruz, especially the meningitis C vaccination, which was developed in Biomanguinhos, the cysticercosis vaccination. It was developed at the IOC, and it's in phase 3 with very satisfactory results. Besides the improvement process and the studies conducted with yellow fever, which allowed us, for example, the measures regarding the fractioning of the vaccination or its expiration date were conducted based on evidence obtained by the clinical trials at Fiocruz. So besides all of these capacities, we also have important production activities. I will speak of this later. It's important to highlight that we are an important part of the quality control in health. I always say that the Fiocruz ecosystem has the role of the NIH, the CDC, part of the FDA, because the technical branch is located at Fiocruz. It's the National Institute of Health Control. It conducts the tests, the development of methodologies, defines the guides and the rules for this legislation, and this is very important. So we always highlight our hospitals. We have 2 hospitals, the National Institute of Communicable Diseases and the National Health Institute for Women and Children, the IFF, and we also are very active in basic health care. I highlight the program for breastfeeding, which was a pioneer initiative established by Fiocruz in 1943. It's the oldest initiative of this kind in the world, and today we count on more than 200 human milk banks in Brazil, the Americas, and Africa. It's a very important initiative. And our activities in teaching are very important. We have 25 programs, postgraduate programs. We have many specialization courses, over 50. We have 2,500 people who graduate from our postgraduate or specialization or doctorate courses per year, and a large number of students who graduate in these activities of professional training, health agents. We have trained more than 50,000 workers in this area. And one of the programs that we are very proud of presenting is a multidisciplinary program that involves our production units and our academic units, which is the postgraduate program for the economic complex of health. So it regards looking and resolving problems. You have a demand for a challenge that must be defeated, and at Fiocruz we will look at, we will have this academic area that can fill these gaps to resolve problems. This program will have an academic advisor at Fiocruz and a practical advisor either at the private company or the productive sector. What's most interesting about this complex ecosystem is that it can give responses at a very fast rate. So regarding the Zika case, I can show you how this can work beyond the association that I told you regarding the infection and the congenital formation. We were responsible for a big part of the information generated during this outbreak. We identified that for the first time it was circulating in the Americas was in May. We looked at a variety of works.
In the placenta or amniotic fluid, and this is the proof of sexual transmission. And at the same time, we had this activity in basic research because we didn't understand well the Zika infection. Fiocruz also was able to plan the first response. So adapting, for example, the methodologies to fight the mosquito, the dengue mosquito, to check if they would be effective in the first Zika response. So our programs in eliminating dengue, after proving that it works not only for dengue but also for Zika and other mosquitoes that artificially produce Valbach infection in Aedes aegypti, they are not capable of transmitting the video. This is a very important project with ecological sustainability that is quite interesting. I can't speak of it now, despite the other activities in terms of pesticides and biological pesticides. Besides the first response, we are working on the second one with the effective participation in the development of vaccines. We approved 3 projects in Brazil. Of them, 3 had a concept test that was satisfactory, and Fiocruz took the responsibility for the clinical trials of these 2 potential candidates. Besides that, I think it's very important that disruptive technologies with the synthetic vaccines working in a new level, and we'll see something in the afternoon of people using RNA sequences or synthetic epitopes. These groups searched for Fiocruz because they understood that here we would have competent researchers knowing how to manipulate the virus and know the immunology of infection, and doctors working with patients and manufacture conditions to produce the preclinical batches and carry out clinical trials. So these are very important partnerships we have. I think in this sense, what we are discussing here in terms of innovation hubs, it's important to mention the role of Fiocruz within the unified health system. It is the greatest public system, health system in the world. So we have more than 200,000 million inhabitants, and more than half of it depending on the single unified health system, providing in a free way all the inputs for the population to receive proper care, health care. And it is very important because health represents almost 9% of Brazilian GDP. If you take the direct and indirect workforce, almost 10% work in health. We spend more than $100 billion a year in this complex of health. And although it is a great challenge to the country for giving sustainability to this unified system, it is also a great opportunity because health is an important target target for research and development. So it is very important for us to use in a rational way the public power to produce development. And this is the basics of the policies created in Fiocruz that was created for the economical and industrial complex, talking about the rationalization and the power of supplying products with a better price and also promoting the technological development and innovation due to many mechanisms like technology transfer and development of our own researchers. I'll illustrate how it can work using the case of the biological drugs. They are the ones who are coming out over the last years, like new therapies, and in terms of expenses, in specialized components for pharmacies and the Ministry of Health, we have drugs being less than 13% of the total drugs acquired, but the cost is more than 65%, so they have a huge impact. And if we look at the monoclonal antibodies, the biological molecules that are more commonly used, and if we compare them to the average price of the monoclonal antibodies where we had the process in partnership with the productive development over the last years, and the control that is the group where we didn't have this kind of partnership so far, but now we are starting to do that. But anyway, we can see that over the first 5 years, the group subjected to this policy with the partnerships for collective development reduced 55% the prices paid by the Ministry of Health, whereas the control group had an increase of 10%, showing that this step of reducing prices was reached. But at the same time, we promoted a good institutional development, and I'm showing Biomanguinhos here with the growth it had from 2006 to 16. And we can see it clearly in the plant because it's practically a Chinese growth. It's absurd, but we are incorporating these products with the use of these policies. And it is important to mention that it allowed us to innovate over the last 5 years. I mean, bring new products from this processes of transfer of technology. It's important because we learn a lot and we receive new technology. Biomanguinhos had 15 new products incorporated, and Biomanguinhos had 11. Many of them, besides the vaccines and the biopharmaceuticals. And here I'm almost over in my speech, and I would like to show our role in this innovation hub. This is the name Fiocruz must take. We can be one of the innovation points in health because we have this innovation chain from basic research to industrial activity. Just to mention, out of the big top 20 companies, pharmaceutical companies, in terms of income, and this is data from the report of 2018, with data from 2017 of the national surveillance. Fiocruz was not the 90th, but the 80th place between the big pharmaceutical companies in Brazil. Among the top 10, we have only one public, that is Fundação Oswaldo Cruz, and multinational companies and international groups. The other official lab that we see in the top 20 is Butantan in position 19. So if we are talking about innovation hub, we need to take costs and intelligence, considering technology to spread in different fields, in or out the facilities. And now I have to emphasize that in this role of Innovation Hub, the prototype plant will be very important because it will be the bottleneck for the production of our products that are under development, but it can also work and must work to leverage the innovation in health, because innovation in health is a little bit peculiar. Okay, I cannot get the next slide here. But anyway, I'll talk about it later on. In terms of innovation, what we have to propose in Fiocruz is to have the ability of introducing new products with the partnerships for productive development, with the purchase power of the state. We identify the products, and in Biomangrinhos and Farmanguinhos we produce new products, but we also finance in our activities of foment and internal activities that this is something important, and we decided to keep it in a specific moment where financing for science and technology activities are facing a huge cut, and it is important for us to save on other areas and to have the project that is called Innovation at Fiocruz with an initial budget of $10 million to have the fundings for different calls for bidding, which may be traditional ones in research for generation of knowledge and new talents, and also it's very important for us to have two calls for bidding for the development of products. The first one, seed money, where we'll have the chance to bring innovation ideas and we'll bring resources for everything to be tested in terms of concepts, and then the ideas that have gone through all the requirements that are posed, we have an amount of money that is quite huge to ensure that the products will be at the end, will go through the end of the clinical phase. We have about 23 products being funded, more than 100 ideas, and more than 115 products projects for the knowledge chain. And how can we work in terms of innovation from the internal point of view? We have a pipeline of ideas and products being financed, and we'll manage that. Thank God we have providers, but Fiocruz bought the ideas and products, so we'll manage not only how it will be dealt, but we'll also follow the development of the project. And we told the researchers that if we believe they are not working well, we'll take it from them and give it to people with expertise on that, because we need a product with the Fiocruz brand, and it will be put along with our patent portfolio, because indirectly we also spend about 2 million a year to keep the portfolio of about 100 patent files. So in this entrepreneur environment, we will have differently from the other companies with the vocation of selling to companies or having acceleration process. We'll first have the internal acceleration. We did that with the Innovation Coffee, and our patent portfolio was systematically introduced to BioFar and MP, and it was quite incredible because it was carried out 4 months ago, and it's incredible to see how far they went in 4 months and our maturity, because now we have an articulation that we didn't have before. It was something personal, just a researcher talking to a friend, understand, but now it's an interesting way we deal with that. And more than that, we'll also have our portfolio and what is not absorbed by BioFar and the Ministry of Health, we'll give it to society, and it will be made in different ways. Up to now, we tried to sell the intellectual property to companies. Now we are migrating to the entrepreneur program, and we want our researchers to have the possibility of exploring the intellectual property from 3 to 5 years. So we'll pay for the property, but we'll be like partners of the companies, and from 3 to 5 years, the researcher will be able to leverage the business. Differently from other startups, will be in a spin-off process that at least by contract we'll be partners and we'll keep on investing and give our name Fiocruz. And also, aside from this internal role, Fiocruz has this role of innovation hub to help improve health in Brazil. And this is a case that most of you know. We have Teramos Diagnosis, a company that was created less than 10 years ago, and 2 years ago it was worth $10 billion. I mean, 3 Embraers and something else. And last October, its value was 0 because they had a wonderful idea for the diagnosis with microfluids and parallelism. Everybody knew it was wonderful, and it was sold as an app, or like a unicorn, as we call, of a radical innovation, and we leveraged all the money, but then it was missing the scientific and technological consistency for the development of a health product. And this is the role Fiocruz might have. We may test our industrial competence in ensuring quality control, the regulation expertise to guide innovations that are important and ideas to be fomented, but done in an environment where innovation is quite strict, where we have operational and standardized procedures from the lab to the product delivery. This is the role of Fiocruz in this innovation hub. I was talking to my colleagues before, and I said it's very interesting because we present there an ECT with development, but we need to be an industry as well, and we need to be a public industry which can absorb knowledge generated at the universities and help good ideas not to fail. Thank you very much for your attention.
Obrigada, Marco Aurélio Krieger.
Thank you.
A próxima palestra do Inovation.
Our next lecture at the Innovation Hub will be about the innovation assets of Biomanguinhos. It is a lecture that was planned to be made by our Vice Director of Technological Development, Sotiris Massailides, but he had an issue to get here. His flight was canceled, so he will be represented by the Advisor of Technological Development, Macerisal. Good morning to everyone. First of all, I'd like to thank your participation at the event and apologize. I'd like to express Dr. Sotiris' apologies because he had this issue and was not able to be present. I will speak to you about our technological development, speaking about our portfolio of initiatives and projects that we have. First of all, I'd like to present our organizational structure. We have the Vice Director of Technological Development, 4 programs under this. These 4 programs have to do with bacterial vaccinations, viral vaccination, biopharmaceuticals, and reactives for diagnosis. We also have organizational units that are listed below. There are 7 labs in total and 3 locations that give support to the projects for technological development as well as technological transferring and other partnerships. So we have 1 lab for antibodies, monoclonal antibodies. We have a technology lab, the lab for bacterial technology, the lab for diagnostic technology, the lab for virology. We already mentioned the recombining technology, the immune technology, the micromolecule lab, and we also have 3 nuclei for support, for sterilization, for elaborating materials. We have a lab that is experimental and gives support to our production, and the Center for Biosecurity. Speaking a bit more about our programs, we have their objective is based on prospection of new opportunities for projects and partnerships and products. We are always searching for new technological alliances that can favor the development of our internal structure so that we can really work on the support for these projects. So as Dr. Krieger said, at Fiocruz we have a great deal of experience in the part of basic research as well as in the developmental area, the industrial development area, and Biomanguinhos is exactly in this development area. The focus of Biomanguinhos is not the basic research, but the development of products and platforms that support the development of these new products. How do we structure the reception of new ideas and products and projects? Recently, we finalized our strategic planning, and all of our products and projects are geared towards the results that we obtain in our planning. So any initiatives or projects that we have are directly related to our planning. And here we can see that in the beginning, when we receive a proposal for a new project that comes from an organizational unit or the board of directors itself or our group of new businesses, we have this initiative that is being taken to the vice directors of technological development, and once this is approved, we release the proposal to be able to obtain internal or external resources. So we have initiatives the Inova Fiocruz, which supports new ideas and platforms, and external financing as well that can come from CNPq, BNDES, and others. So once the authorization is received and the approval to start the development is released, then we have the initial tests. And once these initial tests are established, the project returns to the vice director's area, and the project becomes a part of the selection of Biomanguinhos. Here I'm just showing you an idea of how we manage our portfolio. So in the beginning, we are concerned with identifying and classifying, as well as analyzing the proposals for projects. Then we have the advising of Biomanguinhos, which supports the board of directors so that we can look at and analyze our portfolio. And after this analysis, we can prioritize the projects. Once this prioritization is approved, we will communicate which projects have been approved, which have been interrupted, and which deserve considerations and recommendations in order for their development to be continued. Finally, we always maintain the evaluation of the project's performance. It is evaluated frequently by the deputy directors. Our portfolio also involves projects regarding management and quality and production. Here I have our portfolio for biopharmaceuticals. We have the inhibitors. Excuse me, I should have changed this. We have the checkpoint inhibitors, the immune checkpoint inhibitors. We have some technologies that are being developed for capsulization of RNA interference, and the development of fragments of antibodies for Staphylococcus aureus. We have developed the Morino antibody that has patents in several other countries, but we are now focused on the humanization of this antibody for therapeutic reasons and thinking of the use of this fragment. We also have a biosimilar element in our portfolio that is being developed. We have already started the comparison trials, and it was authorized to be formally submitted. We also have a collaboration with a clinical trial, phase 3 of the epidemic recognition area. It is used for diabetes. Regarding bacterial and viral vaccines, we have the beginning tests, and we have those against Streptococcus galacti. We also have the development of a vaccine, of different vaccines, and an activated dengue vaccination and a subunitary yellow fever vaccine. In the preclinical, we have the development of a multivalent meningitis vaccine, and in phase 2 We have improvements for the yellow fever vaccine. It's a project of ours. And at phase 3, we have meningitis 3 conjugated, which is already in phase 3 clinical trials, and the attenuated vaccination for rubella. In the diagnosis area, we have 2 areas. We have the quick tests based on lateral tests, and we also have our molecular platform. So for the quick tests, we have the proof of principle for Chagas, syphilis, leptospirosis, hantavirus, and leishmaniasis. In phase 1, we have the platform for epidemiological surveillance, a proposal that we can look at regarding new issues like gastroenteritis and respiratory viruses. And in phase 3, we are looking at development and reproduction of pilot lots for these other diagnostic tests.
We know this at the spread inactive with the proposal of diagnosis for HIV, HCV, and malaria, FlexNet, that is finishing its standardization as in terms of pilot batches, and it was developed with the proposal of complying with the hemocenters with a lower demand than our kit offers. And we also have the platform for microarray or multitest to anti-HIV, HBV, HCV, syphilis, Chagas, and ATLV 1 and 2. Well, that's what I had to tell. Thank you. This was the presentation of Biomanguinho's assets and Fiocruz assets, and now we go to the next speech, next presentation. Let's just check if everything is right.
Pelo aplicativo dá para fazer. Pode? Tá. Bom, então... Passa para ele. Então, a próxima palestra será Empreendedorismo para
next
Inovação,
speech will be
proferida por
Entrepreneurship
Eduardo
for
Emmerich
Innovation
CEO da
by
Biominas.
Eduardo
Por favor, Eduardo.
Emmerich, CEO from Biominas. Please, Eduardo.
Obrigado. Me pediram para falar pouco sobre a
Well, I
Biominas,
was
o que
invited to
a
talk
gente,
about
o que a gente faz e como é
Biominas
que a
and
gente
what
se
we do
encaixa nessa
and
cadeia
how
de
we
inovação.
get into this innovation
Então,
chain.
eu vou
So
mostrar um pouco do que a
I'll
gente
show a little
tem
bit
feito.
of what we have done.
E se vocês quiserem fazer
And
alguma
if
pergunta,
you
alguma
want to
dúvida, eu estou
ask
à
some
disposição.
questions or
Durante a
clear
apresentação
in
ou
doubts,
após
I'm here
a
available
apresentação.
to talk to you during the
Não sei se vocês
presentation
têm
or even
depois
afterwards.
um horário para tirar pergunta ou não?
Do we have a time for
Se alguém tiver
Q&A?
pergunta,
So if you
quiser me
have
parar,
questions,
por
if
favor,
you
fique à
want to
vontade.
interrupt me, please feel free for that.
Então, iniciando, né, a Biominas
Just
é
to
uma
start,
instituição
Biominas
privada,
is a private
né, foi criada em
institution
1990,
created in
29 anos atrás, em Belo Horizonte, com o objetivo desde o início de criar inovação em ciências da vida, né? Então a gente é muito focado na questão de empreendedorismo e de inovação. E eu costumo dizer que a gente já era focado em inovação e empreendedorismo antes de a gente chamar de empreendedorismo, inovação, startup e etc. e tal. Então, né, muito antes disso, a gente já trabalhava com isso e sempre com a missão de criar negócios. A gente nunca teve nenhum papel como centro de pesquisa, como centro de desenvolvimento. A gente não faz pesquisa, a gente não faz desenvolvimento. O nosso trabalho principal, né, eu vou falar um pouco sobre os outros também, mas o nosso trabalho principal é identificar projetos de pesquisa, né, que tenham potencial e ajudar esses projetos a fazer então a conversão e virar um negócio e progredir e crescer, né? Então a gente está focado mais na parte depois da pesquisa e pegando um pedaço do desenvolvimento e chegando até a empresa e inovação. Então, em 29 anos,
in
né,
29
a
years,
gente já fez um bocado de coisa.
we did so many things,
Dentre
and
elas, a gente já
among
analisou
them,
3.000
we've
tecnologias.
analyzed 3,000
Só nos
technologies
últimos 3 anos,
over
né,
the
com o
last
programa
3
de aceleração,
years
eu
in
vou falar um pouco
terms
sobre
of
isso.
acceleration,
A
and I'll talk a little bit
gente
about
recebeu mais
it.
de
We
1.000 quase 1.000
received more than
projetos.
1,000 projects, and
Selecionamos
we selected
150 e hoje a gente tem 8,
150,
né, não
and
6
today we have
projetos
8
em aceleração.
projects under
Desde
development.
1990, nós fazemos a gestão de uma incubadora de empresas, né, que está situada em Belo Horizonte. Então a incubadora fez 22 anos agora. Ela foi criada para ser uma incubadora em ciências da vida, então ela foi possivelmente a primeira ou a segunda. Tem dúvidas aí se a BioRio foi criada antes, durante ou depois da gente. A gente foi criada mais ou menos na mesma época. Mas nós somos uma das primeiras incubadoras do Brasil, né, uma das 5 primeiras incubadoras do Brasil, em qualquer área. E aí, então desde 97 a gente vem incubando empresas. Então, nesses 22 anos de incubação, a gente já tem mais de 50 empresas que passaram pelo processo de aceleração ou estão no processo de aceleração. Então, temos 35 empresas que já graduaram, né, empresas que já entraram na incubadora, já saíram da incubadora, e hoje a gente tem mais ou menos umas 15 que estão no prédio. Essas empresas, em conjunto, elas faturam mais ou menos 100 milhões de reais, então dessas 50, elas faturam mais ou menos 100 milhões de reais por ano, e já geraram, né, ao longo desses 20 anos, mais de 250 milhões de reais em imposto, né? Se vocês
If you account the revenue over the 20 years, we have more than 20 billion reais. So this is something important in a sector where we have just a few small companies working always the same way. So a little bit of public policies that we have to learn how to develop. It's not always that only big companies who generate results, even in terms of taxes for government. It's the sum up of all small companies that push an important economy, which brings big cities or big centers to promote entrepreneurship as a way of generating revenue and having a diverse ecosystem. As of 2001, we are a company generating content for the Technology Center, and as of 2014, we have a partnership with Bayer to have Bayer Latin America and Brazil. If you don't know, Bayer is a big group of companies with 1,100 members and with a big event in the United States that is the big reference in the technology sector. It's the biggest one in the world. And in 2014, they reached us for a partnership for us to have an event in Latin America. It's a joint event. About 50% of the event is their responsibility, and the other 50% we are responsible for. And we work in this event every year. It's always in September. Last year, in the middle of last year, we had a discussion on strategic planning, redefining our plans, and we defined the 4 important working pillars. If you want the slides, they are at your disposal. Don't need to be taking pictures. We can send it to you. Because I see you taking pictures. Okay, if you want, you can, but no need. So we redefined the 4 working pillars. There are these ones. The first one, I'll talk about each one of them. So the first one is Academy. And why are we discussing about education? Because with the programs that we have and talking to entrepreneurs and having access to researchers and so on all the time, we could see that entrepreneur education is missing. People are not trained to think in an entrepreneurial way as a researcher or as a public institution or university or as a student or even as a professional in the areas. This is not the kind of training we receive at schools. Only a few schools have this teaching today. They don't teach innovation and entrepreneurship. So the idea is to generate content, courses, and promote activities for education and entrepreneurship and innovation. So over the next weeks, we'll have some new courses launched and a distant course, and they will be available for you, and we'll have speakers to teach in areas in such a way that we can complement people's training in this area of education. We have a partnership with Butantan. Butantan has an MBA in Management of Innovation, and they asked us to help them increase the number of people in the course, and they have about 20 people, and they want the course to grow a lot. And also to take some of the content to the distant teaching course. So over the next weeks and months, we'll be taking some content to distant teaching. The second area we work, as I mentioned, is the think tank, the information generator in the sector. And as of 2001, we generate studies on the sector of life sciences and biotechnology. And we do that basically because nobody else did. So we had no information on the sector. We didn't know the number of companies or what they did or their stage of development. And whenever we went abroad and talked about Brazil, people said, okay, but how many companies you have in Brazil on biotechnology? We didn't know, nobody knew. So in 2001, we started with these studies that ended up being the main reference, data reference on the sector of biotechnology. And all the studies are available on the website, and they are free if you want to download. Just go there and do it. Now we are bringing a new study along with Deloitte, and we are now collecting information from the companies on the sector and the expectations and trends and so on, and they will collect information till the end of May for us to launch a report and have the study in the next bio in September in São Paulo. And I invite all of you to be part of it. People generally are taking part of the event as sponsors or being part of it, and we hope your projects are there as well. Krieger and everybody else is more than invited to be part of it. The third area we work is in the area we call corporate. And what is corporate? It's basically working on the other side, helping big companies in their innovation efforts. You see the area that we work is with researchers and people to create the companies and also to help the companies to talk with the startups and create partnerships with the startups, and before that develop their own innovation strategies.
Esses dados aqui que
This data
bem interessantes, né, que foi estudo que foi feito pela
are quite interesting. This comes from a study from ABN, CBN sites.
Que fala que 84%
and they show that 84.9% of big American companies in all areas, and not only health, they see innovation as something that is very important. So this is a very important item to them. But then, when we analyze it better, only 43% of them have an innovation process defined. So they believe it's important, but they don't work to have an innovation structure to deal with the subject. And another important thing is that most of them are more concerned about innovation of process and internal innovation of process, understanding the client or even the workers. So the main sources of innovation they see in the big companies is the clients or the employees, and not exactly understanding the market trends and the new technologies being developed to generate innovation, in fact, and change the business in the companies. So this is a little bit of what we are working with the companies so that they understand very well how, where they are and how they must be in terms of innovation. So we've been working with many companies in terms of corporate, and we deal with the most important pharmaceutical companies like Roche, Sky, Sanofi, and Ferri, and so on. And now we have a call for projects by Roche. They have a project called Astro, and we are dealing with the platform to evaluate the projects for Roche. We have a program with a GSK and FAPESP and many others dealing with companies, not only pharmaceutical companies, but also other areas. We've worked with Petrobras, Natura, Vale. I know it's very complex to be here talking about Vale, but we've worked with them. And we've also worked with a Fiocruz. And for investors who are interested in the area, we work a lot with this universe of big companies. We are also creating 2 hubs, and I was seeing Krieger talking about Fiocruz Hub. We are creating 2 of them, one in São Paulo along with IPT. IPT, if you don't know, is the Institute of Technological Researches from São Paulo's state government. And basically they test the industry and all areas in the industry. And they have this building that they call the BioHub. This is a wonderful building, and they want to crowd this building with the startups and companies to create an innovation ecosystem. So they request our help to create this hub, and we are creating along with them in São Paulo. We are talking to many startup companies at this moment.
And we also have a new project in Belo Horizonte, looking at an area that is in our incubator building to create a innovation hub in Belo Horizonte. The 4th area that we are active in, which is a core of our activity, is this work of helping entrepreneurs from the idea up until the company's creation and the development of the products. I'm just going to run quickly through these slides to show you our development path. We start in the beginning by constituting some labs where researchers can go and work there to develop their ideas. And we have projects of our own that we are developing, because since we can't find a startup that is in a specific area, we create a project, we create a startup in that area. So we start at the very beginning and then continue to the pre-acceleration phase. We have this since 2015, the Startup Lab. Some projects of Fiocruz have gone through this program, and actually they even won the last round. But historically, almost all Fiocruz projects do very well at our program. So the track record is very good for Fiocruz. In this pre-acceleration program, we have already conducted 6 rounds in Belo Horizonte, 2 rounds in São Paulo, and received about 900 projects, of which we selected, at each round, 20 were selected, and of these 20, they go through this program. I'm going to show you a bit how it works. So 160 selected projects by this program. So following this path, we have the acceleration program, And it's different from the pre-acceleration program because it's a lot deeper. So we work a lot more alongside the startups. These startups are invited to participate in the acceleration program. We see the potential in these startups, so we invite them to come to the acceleration program. Today we have 8 startups in this process. Another important matter here is that in the pre-acceleration program, the group that participates does not pay absolutely anything. It's totally free for the researcher. But in the acceleration program, Biominas becomes a partner of the business, so there is a different participation here because we have this management role and we promote the development of the business. And continuing to the companies that already have a more advanced stage, finalizing the development stage and going on to production, we have the incubator of companies, which is the building I showed previously. It has 3,000 square meters of area of space. We have 14 incubated companies. So we have 35 graduated companies. And this is our universe, 160 startups that went through this pre-acceleration program, 8 startups that are in acceleration, 13 in incubation, and 32 that have graduated. So just to show you the pre-acceleration program and how it works, we have this group of engagement and inspiration activities to promote, that are promoted at universities and research centers. And people sign up. We have a platform online so people can sign up. And from then on, we select about 50 projects. These 50 projects go through interviews. We interview all 50 of them and select 20 that will spend 3 months with us conducting these 2 main stages. One is the bio-business model, where we work strongly on the issue of developing the business plan. And after that, well, we have a variety of tools that we use to help to build this business plan. So we will understand what the market is, who the clients are, how these clients decide to make their purchases, how much it should cost, what the price should be, what kind of partnerships do you need. So all of this is discussed at this moment. And after that, we go through a lab phase, which is very deep for some areas, the intellectual area, the investment area, the regulation area, so we can have a complete vision of the program. And at the end of the program, we have the demo day where the startups present themselves, introduce themselves to potential investors and potential partners. As I mentioned, we have conducted 8 editions of this program. Other countries have also sent projects in. 23 states have sent projects for this program. And there are a variety of institutions here, Butantan, USP, UFMG. We also receive projects from Stanford, from the University of Sydney, from Argentina, from Chile. So there are many projects here. It's not like we're advertising it over there, but through social media, people get access to the information, and we receive these projects from other countries. Just to show you the end of our demo day, This is the São Paulo round with Interfarm in São Paulo, the first round. And then the second round, which was last year, I think you might recognize some people in the photograph. Tatiana is over here. They are from Fiocruz, because Fiocruz won this round of the program. So just to conclude here, these startups are in the acceleration process. There are 8 of them. So just to speak a bit about them, we have an area that talks about animal genetics, the transformation of kitchen oil into biodiesel. This is going very well. We have 2 contracts, one with Gerdau and one with Votorantim. The other one is Hakuna, that is producing food with an insect base. I know every time somebody hears this, they're a little bit surprised, but so this is food for the animal market as well as the human health market. The other is Vet Solution, that develops technologies developed in the Federal University of Minas Gerais. It's a therapeutic vaccine for leishmaniosis. It's very interesting. Then we have NanoPack. They are developing a nanofilm that increases the expiration date of fruits, and so they can be exported. Right now they can't be exported, but there are some fruits we can't export, but with this new technology it's possible. Guava, for example. Duna is a company that we created in Natal at the end of last year. It was a group of researchers in computer sciences, first to offer services and explore different possibilities in genomic analysis. Adarna is a company, a data company for data management in health. So there's an interesting convergence here between computer science and this. We're exploring this opportunity. Finally, we have Biopitame, which is a company with researchers from USP that develops different initiatives for the treatment of cancer. This startup was developed for the acceleration of Hebo Bayer in England. They're spending 3 months there with the acceleration program, and our team is with them to develop their project. So that's it. My email is here, my phone number as well, if you'd like the slides or if you have any questions. Thank you very much. Thank you, Eduardo Soares, for your lecture.
Acho que agora teremos o intervalo, não é isso? Até 1h20 da tarde. Muito obrigada.
Afternoon. Break till 1:20. Thank you.
Ah, então tá.
Acho que não seja difícil. Muito obrigada. Muito interessante a apresentação. Eu gostaria de saber os processos de aceleração, se eles podem ser aplicados para startups que não estão fisicamente localizadas em Minas Gerais.
Então, várias delas não estão em Minas Gerais. A maioria não está em Minas. Por exemplo, a Hakuna está em São Paulo, a Duna está em Natal. Então a gente faz aceleração também em outros lugares que não é remota.
Não precisa não.
A gente faz encontro com elas.
É melhor falar.
elas vão a Belo Horizonte, a gente vai também a Natal, vai a São Paulo, mas a grande parte a gente faz remoto. O dia a dia a gente faz remoto. Ah, tá. Para tradução, desculpa.
Eduardo, eu sou Priscila, sou da diretoria de Biomanguinhos.
Eduardo, I'm Priscila from the directorship of Biomanguinhos. I would like you to talk a little bit about your experience in organizations that are starting to implement this stronger culture in innovation management and entrepreneurship. I know you have some actions in policies and support to this culture, this behavior, this entrepreneur behavior. And with your expertise with the public sector, and okay, you have more experience with the private sector, but do you have any with the public sector? Because when we talk about foundations with public rights, we have some legal restraints, and we need to find innovative solutions to have this model working. So I would like you to talk a little bit about your experience. Well, I think we don't have any kind of expertise or experience as a public company, like with a corporate client, but it doesn't mean we don't have expertise in dealing with public institutions. In fact, most of our projects come from the public universities. Most of the projects that are in the pre-acceleration process come from public universities, so we have a great experience in dealing with public institutions. Because we see a huge potential in the universities in terms of research. We've been discussing how to develop similar processes in Fiocruz and helping promoting them. Because when Fiocruz is in our programs, they go very well. We know that we have a big set of competences in the institution, so we are always at your disposal to help in this process and, in fact, try to contribute so that projects develop more and enter more on the market, using all the chain of Fiocruz in terms of production. Probably we lack a little bit of structure in the business, but all the components Fiocruz has, even the production is very good. And I would like to talk a little bit about the history, because I've had a relation with a project from here with the Mirantendler vaccination. We licensed their technology to a company, and then we sold this business to Ouro Fino. But during the time we were partners of this technology, we could bring money. I mean, our money, we invested in this business, and we brought money from investors, and we brought about 5,000 reais from FINEP to the project. So we kept the project for some years. So we know that, in fact, we have a lot of projects with this capacity of entering in the market, and we are really interested to help that.
Desculpa.
Well, culture is always complicated. We believe that private companies have no culture problems, but it's not true. They have a lot of them. Sometimes we work for a company, in a specific company, a big one, and we have many problems to deal with. But as I mentioned, this is a specific and critical point that we see in the ecosystem in general in Brazil. I mean, this culture of entrepreneurship, of facing the risk, of dealing with the research. And this is something we have to work a lot to change, because We need to create mechanisms to promote
essa facilidade em levar as coisas
this
para frente.
easy way of taking things ahead, and it also has to do with having successful cases. If we can build cases, these cases will end up being examples to other people to do the same. So this is a little bit of our mindset. Thank you. The Innovation Hub will start again at 1:20.
Boa tarde. Retomando as atividades, então, do Innovation Hub, vamos ter a sessão paralela agora, entendendo a resposta imune à dengue, à infecção por dengue e sua vacinação, com a doutora Hansi Dean. Ela é microbiologista e imunologista e tem experiência no desenvolvimento de vacinas, em virologia, em desenvolvimento e pesquisa e desenvolvimento de produtos e gerenciamento de projetos. Hansi Dean, please. Sorry. Yeah.
Thank you so much for the... Can you hear me? In the back?
Ok, vocês conseguem me ouvir? Muito obrigada pelo convite. Eu agradeço pelo interesse na dengue e nas vacinas. Eu vou falar sobre 3 tópicos diferentes, a maior parte sobre dengue, imunologia e virologia, e qual é o perfil de resposta imune para dengue, quais são os efeitos, e o perfil de resposta imune também para a nossa vacina candidata, que é a TEC 003, e depois eu vou dar uma atualização no final sobre os nossos desenvolvimentos clínicos da vacina. Em primeiro lugar, o vírus da dengue tem um genoma que codifica 3 proteínas estruturais e 7 não estruturais. As proteínas estruturais estão aqui e as não estruturais são o resto do genoma. E, na verdade, tanto as proteínas estruturais quanto não estruturais são alvos das respostas imunes. Então, não é só uma questão de neutralização de anticorpos. A vacina da dengue tetravalente da Takeda é basicamente para fazer com que os 4 componentes da vacina aqui nesse alvo, que são as proteínas DENV da proteína 1, 2, 3 e 4, passem pelo backbone do genoma. Isso significa que a composição da vacina é criada para elicitar respostas imunes tanto para as proteínas estruturais quanto não estruturais do vírus da dengue. E quais são as evidências para respostas imunes protetivas contra a dengue? Na verdade, essa é uma área de pesquisa muito intensa agora e não são informações completas ainda, mas o que nós sabemos, em primeiro lugar, é que 1 ou 2 infecções podem conferir imunidade protetiva contra uma subsequente infecção por dengue. E depois a gente sabe que a neutralização dos anticorpos pode estar associada com uma probabilidade reduzida de infecção de dengue sintomática. Há alguns estudos que sugerem que a qualidade ou a especificidade da neutralização dos anticorpos de neutralização também tem um papel, e tem novos dados mostrando que anticorpos NS1 também podem ter uma imunidade protetiva, quer dizer, pelo menos contra desafios letais. E há estudos mostrando uma associação entre respostas imunes celulares e proteção contra a dengue sintomática. Eu vou passar um pouco aqui sobre as evidências. Em primeiro lugar, aqui temos dados do Brasil que mostram a ocorrência de dengue por semana e por serótipo no Brasil. E vocês podem ver que começou em mais ou menos 2005, 2006, com um grande surto de dengue 3, que foi substituído ao longo do tempo por mais dengue 2 e dengue 1 e depois a dengue 4. E nós estamos aqui, você sabe o que acontece depois, que é a zika e a dengue que também aparece de novo. Então, isso é consistente com a ideia de que há uma população de imunidade que confere proteção contra um ou outro serótipo. Esse é um estudo feito por Eva Harrison e o grupo dele da Nicarágua sobre a associação dos anticorpos de neutralização e a infecção sintomática. E o que esse gráfico mostra é que os títulos de anticorpos de neutralização e uma infecção aparente são maiores do que uma infecção sintomática. E, na verdade, é uma probabilidade reduzida de infecção sintomática conforme as titulações de anticorpos de neutralização crescem. Nesse estudo, nós temos uma média desses anticorpos de neutralização para todos os serótipos. Vocês podem ver pelos dados que a diferença não é tão grande aqui. E que ainda há pessoas que têm titulações baixas de anticorpos que são protegidas e pessoas com titulações altas que não são protegidas. Então, isso sugere que outras respostas imunes também podem contribuir para o surto e para a aparição da infecção. E a qualidade ou especificidade das respostas? Essa imagem mostra a estrutura do diâmetro de envelope que cria a superfície do vírus da dengue. E tem muitos anticorpos de neutralização que foram identificados, os epítopos foram identificados, e não que sejam alvos importantes para a imunidade protetiva, mas nós também temos anticorpos de reação cruzada que são identificados, e eu estou mostrando alguns deles aqui, e também há anticorpos de neutralização fracos ou não, que também são epítopos que aparecem no laboratório. Então, no fim das contas, a especificidade de neutralização dos anticorpos após uma infecção por vacinação é complexa, não é uma história simples e clara até agora. E o NS1? O NS1 é uma proteína que implica na mediação do vazamento vascular, que tem a ver com a febre da dengue hemorrágica e com essa doença. Há dois mecanismos diferentes que foram mostrados para o NS1 como mediadores desse vazamento vascular. Um tem um efeito direto, e o NS1 promove o vazamento, e o outro é um efeito indireto, em que o NS1 ativa uma resposta inflamatória através do receptor TLR4. E, na verdade, os anticorpos do NS1 bloqueiam ambas as vias. E essa ultrapermeabilidade endofílica do NS1 pode ser moderada in vitro com um modelo bastante comum que nós usamos para medir essa corresistência por esses medidores endofílicos. Além disso, estudos também já mostraram que o efeito da vacinação com NS1 pode proteger camundongos contra o desafio letal da dengue. E isso, em conjunto, sugere que não só anticorpos de neutralização, mas também os anticorpos do NS1 podem contribuir para uma imunidade protetiva. E, finalmente, olhando para a resposta imune celular, há uma série de mecanismos diferentes de resposta celular que podem modular a severidade, a gravidade da doença, e é bem sabido que a infecção por dengue ativa tanto o CD4 quanto o CD8 em resposta, e esse gráfico mostra a especificidade dos epítopos da resposta ao CD8 a uma infecção natural por dengue, e essas são todas as proteínas do vírus da dengue na parte inferior, e vocês podem ver que há uma resposta celular que ativa todas as poliproteínas. E nós temos proteínas não estruturais, em particular no NS3, N4, N5, NS1, que são geralmente dominantes imunologicamente. E estudos também já mostraram que há um HLA que também é associado à proteção contra a dengue, a infecção por dengue, e esse HLA é associado a uma resposta celular da célula T maior. Então, em geral, há uma sugestão de que essa resposta imunológica também pode contribuir para a proteção contra a dengue. E como que a gente aplica essas informações para entender como que uma vacina pode mediar uma imunidade protetiva? Em primeiro lugar, eu acho que todos concordem que a vacina da dengue tem que, pelo menos, neutralizar a resposta imunológica para os serótipos da dengue, mas nós temos um entendimento científico que sugere que outras respostas imunes também podem contribuir para a imunidade protetiva. E essa é uma parte realmente importante do nosso desenvolvimento clínico da vacina da dengue para entender as respostas imunes após a vacinação. E por que eu estou pensando isso? Porque eu tenho um desenho aqui, eu não sei se você conhece essa historinha do elefante, mas aqui ele está fazendo uma descrição de alguém que estava tocando as espécies, um está tocando. Cada pessoa que toca o elefante vê uma parte diferente dele e diz que é um animal diferente. Então, na verdade, tudo depende do que você está focando. Você precisa entender toda a biologia para entender todo o elefante. Então, é isso que nós temos em termos de dados imunológicos gerados até agora. E, na verdade, pensando sobre essa resposta imune tão abrangente, nós podemos voltar para a febre amarela, que eu tenho certeza que vocês todos conhecem, que já tem uma vacina bem estabelecida e por muito tempo os anticorpos de neutralização traziam proteção contra a febre amarela, mas quando a gente olha numa análise detalhada da resposta imune contra o vírus 17D, a gente vê que tem um grande espectro de respostas imunes sendo ativadas. Então, a visão prevalente nesse momento é que essa prevalência da febre amarela é que nós temos uma ativação da via de resposta imune com o 17D. Então, eu vou falar um pouco sobre a resposta para a vacina de dengue. E, em primeiro lugar, nós sabemos de estudos de fase 2 que nós temos o TAC-03 desenvolvendo rapidamente os anticorpos de neutralização em crianças. E aqui nós temos 4 grupos diferentes. O grupo 4 recebeu o placebo. 1, 2 e 3 receberam diferentes regimes da vacina, mas aqui a gente está olhando 28 dias após a primeira dose. E vocês conseguem ver que o anticorpo de neutralização tem uma resposta bastante alta contra os 4 serótipos.
Nós vimos a questão, as cinéticas das respostas, olhando os 2 estudos. Esse analisou crianças com idades entre 1 ano e meio e 5 anos, que receberam 2 doses da vacina. E vocês podem ver que a resposta imunológica foi relativamente estável durante esse período de 3 anos. E essa é a resposta da dengue 4, que é mais baixa. E depois desse estudo, mudamos a formulação e a proporção. Então, agora está mais estável essa neutralização. Também começamos esses estudos para ver os anticorpos neutralizadores por genotipos. Temos 1, 2, 3 e 4, e a barra azul é a resposta à vacina, e temos um genotipo diferente para cada tipo de serótipo. E vemos que cada genotipo tem uma proporção diferente, que está dentro dos limites da sensibilidade ou especificidade. E estamos interessados em falar com os pesquisadores no Brasil e outros países para entender as cepas e genotipos que são importantes para essas provas e o que está circulando agora. Então, como sabemos que os 4 componentes contribuem para a resposta imunológica? Normalmente, as respostas são mais altas para a dengue 2, que é a 1, 3 e 4, então conduzimos alguns estudos com os anticorpos reativos, que, como vocês podem ver aqui, tiramos todos os anticorpos de dengue 2 para tentar removê-los todos e olhamos para as respostas dos anticorpos neutralizadores à dengue 1, 3 e 4. E o que descobrimos é que quando você remove os anticorpos da dengue 2, isso não tem nenhum efeito na remoção parcial dos anticorpos da dengue 1, 3 e 4. Então isso mostra que os 4 componentes têm uma parte. Então também olhamos para as respostas dos anticorpos a NS1. Do lado esquerdo temos crianças antes e depois da vacina. Podemos mostrar que elas tinham anticorpos para o NS1 da dengue 1.
And
2,
remember, in the
3 e
vaccine,
4.
the only NS1 that's there is NS2, or NS1 of dengue 2. But we see antibodies to conserve parts of NS1 to all 4 of the vaccine, all 4 of the dengue strains. And in pre-immune volunteers on day 0, there already are pre-existing antibodies to dengue, or to dengue to NS1. And post-vaccination, you see an increase in some of the individuals, but not all of them. So as I mentioned, there is a model to measure the functionality of anti-NS1 antibodies in blocking, preventing the endothelial hyperpermeabilization in vitro, by measuring transepithelial electrical resistance, which is on the y-axis here. And this work was done in collaboration with Dustin Glasner and Eva Harris at University of California, Berkeley. So in this assay, you can see here, this is dengue 2 NS1. When you add it to the monolayer, you see a drop in resistance, meaning there are holes poked in the monolayer. And when we added pre-vaccination serum, it had no effect on the electrical resistance. But when you added post-vaccination serum, it completely blocked that effect. And we saw the same for dengue 1 NS1, for dengue 3 NS1, and for dengue 4 NS1, we saw a partial effect. And then the tier assay is very tedious and low throughput. So we asked whether the binding antibodies correlate with the tier activity. And we were able to show that we get a good correlation of the blockage of transepithelial electrical resistance and the anti-NS1 antibody concentration. So then we can use the antibody level as a biomarker for the functional activity. But what about cellular responses? This work is done in collaboration with Heather Freiberg-Robertson and Jeff Currier at the Walter Reed Army Institute for research. In this study, we looked at the interferon gamma ELISpot response rates to dengue 2. And what we saw was that in seronegative subjects, we saw a high response rate to dengue 2 and approaching 100% at 6 months post-vaccination. It was a little lower shortly after vaccination. And in the seropositive subjects at baseline, there was a baseline level, but then vaccination increased the response rate. And I'm not going to show all the data, but we did a lot of detailed phenotyping. And the majority of the response is a polyfunctional CD8 effector response, although we also see CD4 responses. So the CD8 effector response is really important because that's the kind of T cell that's associated with antiviral immunity. And we also looked at the magnitude of the response across dengue 1, 2, 3, and 4. And so these are, I'm sorry this is reversed, these are the seronegative volunteers, and you can see that there's a range of magnitudes of responses for dengue 1, 2, 3, and 4, but there's a high number of responders. And it's pretty similar in the pre-immune versus the naive kids post-vaccination. And just like has been shown for natural infection, we mapped where the immune responses were directed across the proteome. And you can see that the majority of the responses are to the non-structural proteins, and particularly NS3 and NS5 in this study, although in some other populations we see NS1 also being immunodominant. And it's pretty similar across the seropositive and seronegative populations. So what we're really seeing is an immune response pattern where we see multiple arms of the immune system activated and all of the dengue proteome contributing to the immune response. So that includes neutralizing antibodies to pre-M and E, anti-NS1 antibodies, and then cellular immunity to the entire virus. At this point, we don't know the association between any of these specific responses and the outcome of infection. That's something that we're actively researching as part of our vaccine efficacy trials. So stay tuned. So I haven't shown you all the data we have, but overall we're seeing a picture of broad immune responses elicited by vaccination. And that includes of general immune activation. So if you look at innate immune responses early after vaccination, we really see an interferon response profile, which is normal after a virus infection. And then after the second vaccine, we see a real adaptive immune response with quick activation of the genes that lead to antibody production and cellular immunity. And then looking at the cellular immunity, we see a really potent immune activation profile. We also are seeing a broad immune response pattern of antibodies that would be expected to have an impact on infection. So that includes the tetravalent neutralizing antibody responses. We also have evidence for eliciting both type-specific and cross-reactive B cells and neutralizing antibodies. We see neutralization of diverse dengue genotypes, and we see antibody affinity maturation and very high avidity antibodies, which would be expected to be highly functional. We also see immune responses that might impact dengue severity or resolution of infection. So that includes antibodies that block the endothelial hyperpermeability mediated by NS1, polyfunctional CD8 responses, the type that are responsible for killing of infected cells, and cellular immune responses directed to all of the dengue proteins, which suggests that the vaccine should work in people with diverse HLA alleles. So turning to the TAC-003 clinical development, we're assessing the safety and efficacy of the candidate vaccine in clinical trials worldwide in both hemispheres. And to date, we've immunized more than 18,000 participants with at least one dose of the vaccine in clinical trials, and that includes more than 15,000 children to date. Our early trials were phase 1 trials. They were mainly in dengue non-endemic areas, and they were assessing things like the safety of the vaccine, the regimen and dose levels, and basic parameters of the vaccine manufacturing. And then we've conducted several phase 2 trials that were in pediatric and adult populations in dengue endemic areas. And we started our phase 3 efficacy trial in 2016, and it continues now. This isn't the only phase 3 trial we're doing. In parallel with our efficacy trial, we also have a trial in some of the same clinical trial sites looking at cellular immune responses to vaccination in children. And then we have a number of other phase 3 trials ongoing looking at things like vaccine co-administration, looking at manufacturing consistency, and generating data in other populations such as adolescents and non-endemic areas. And that study is being done in Mexico. So we have a lot of trials going on right now. Our pivotal phase 3 study is called DEN 301, or TIDES study. And that's being conducted in a number of countries in Latin America and in Asia. In that study, we randomized 20,100 children between the age of 4 and 16. And there were 26 sites overall in that study. So it's a 2-to-1 randomization, so 13,400 kids were vaccinated with the vaccine and 6,700 received the placebo. And importantly, we took baseline samples, serum samples before vaccination. And that's important because it enables us to determine which vaccinees were previously seropositive to dengue and which ones were naive. And so that gives us the opportunity to assess both safety and immunogenicity in both of those important subsets. We have, the study is 5 years long, and I'm not going to give you every detail of the study, but just to say we have a number of endpoints. Our primary endpoint, which is taken from 30 days post the second vaccination through the end of 1 year post-second vaccination, is assessing vaccine efficacy of 2 doses of vaccine in preventing virologically confirmed dengue fever caused by any dengue serotype in subjects that were pre-exposed or naive. Then we have secondary efficacy endpoints, which are include collecting more data from more cases for 6 additional months, so 18 months after second vaccination. And that includes stratifying the results by serotype, by previous seropositivity and seronegativity, stratifying the data by disease severity, hospitalization, and vaccine-confirmed dengue fever. And then, of course, assessing safety in these populations. In January, we announced that we did achieve the primary endpoint in the pivotal phase 3 efficacy trial. And so that is vaccine efficacy against all dengue serotypes and dengue of all severities. And we're super excited about the results. We're proceeding, we're aggressively forward. I wish I could present the efficacy data, but we have a publication that's coming out really soon, so we'll have to come back and present the detailed results. So and really importantly, we found that the vaccine was very well tolerated in this population, which is really the target population. We saw no significant safety concerns in the analyses. We saw no safety concerns in the naive children, and really importantly, we can actually assess immediately who the children were, who were naive and who were pre-immune. So stay tuned for those results very soon. And finally, I mean, we can't do this work without a cast of thousands, and it all starts with the parents and the children who are participating in the trials, and the clinical study investigators around the world. And I want to particularly give a shout out to the clinical study investigators here in Brazil who are participating in the trial. And then a large staff in the participating countries. This is an active follow-up for 5 years, so it's a massive effort to follow up 20,000 kids every week for 5 years. Then there's a Takeda project team. We have a Takeda clinical delivery and development team, and then we have staff at Takeda and at clinical research organizations who are contributing to the study. For some of the specific immunology data, we have our collaborators at UC Berkeley and at Walter Reed, and the Takeda vaccine discovery team who's generating the immunology data. And then I want to give a shout out to the CDC Division of Vector-Borne Diseases, where some of the early development of this vaccine began. So thanks so much, and I'm happy to entertain your questions. I wanted to mention, if anybody has a question in Portuguese, feel free to ask it. We have the translation. Yeah? Christian?
You were talking in quite some detail about the importance of NS1 and cellular responses. Mm-hmm. Now, in your vaccine, of course, this is all against dengue 2, and you showed that there's cross-reactivity and perhaps cross-protection. How do you explain this on the basis of that the sequence differences between the various NS1s, or also the all non-structurals, is not different from the E protein differences, and we do not have cross-protection between the E protein responses? Why would there be more cross-protection or cross-reaction between NS1 antibodies or T cells, or is there not?
Mm-hmm. I understand your question. Actually, I think there is a lot of cross-protection in responses to the E protein. If you look at dengue natural infection, generally after a first infection, a person is fairly resistant to reinfection by the same serotype, but also has a reduced risk of infection with other serotypes. After a second infection, the risk of severe disease with a subsequent infection is very low, and that includes serotypes that individual has never seen. So you have to invoke the possibility of cross-reactive antibody responses and other responses in conferring protection.
Hello, Ms. Singh. Yes, thank you for your presentation. I really enjoyed it. Is there any correlation between the enhancements of the disease once you have the second dengue, between this cross-reactivity from the E proteins or from the NS1 part of the immune response? Is it correlated with the cross-reactivity from one or another part?
That is a hypothesis based on some data showing that that low levels of binding antibodies as the immune responses wane can be associated with a enhanced probability of severe disease after the second exposure. And we haven't seen that in our clinical trials to date. Of course, the safety of the subjects in the trial is our most important priority, and we have an independent data safety monitoring board who is looking at that. And that's also why it's so important in our development program to look at the persistence of the immune responses, because there is that concern that if the responses wane, you might be in a gray zone where you could potentially get enhanced infection. Our data so far for all of the immune response parameters is at least between 30 days post-vaccination and 1 year post-vaccination. We don't see any decreases, but of course we're going to monitor that closely as we go forward.
Hello, thank you for your lecture. Are you following patients about Zika infection or pre-immune of Zika, and what is going on after the vaccination with your dengue vaccine?
That's a really good question. If I can figure out how to go backwards here. Oh. So we conducted the trial in areas where there was an outbreak of Zika, and also areas where there wasn't an outbreak of Zika. For example, there was a lot of Zika in Dominican Republic and almost none in Panama. And so far we haven't seen any evidence that played an effect, although of course we're looking at that. And of course we have a lot of samples that could be really useful in understanding something about the Zika outbreaks in those areas. We're going to wait until we assess the efficacy of the vaccine against dengue, and if we have samples left, then we're very interested in studying Zika.
heard that in some testing sites, people is claiming right now that some children died of the vaccine because they received the vaccine without being pre-immune. And I saw that you are working some of these sites. I think it's Philippines, if I'm not wrong. And people is still trying to help. The general population is still open for the vaccine trial, or they are getting afraid of that because of the problem over there. Do you know? And what Takeda is trying to do to avoid future problems like that, since right now we are in anti-vaccine campaign around the world, and problems with dengue vaccines can improve the anti-vax campaign.
Yeah, I understand your question. Of course, like I said before, the safety of the clinical trial participants is our #1 goal. And so when we learned about the dengue vaccine results, first of all, I can't really comment on results from another company's vaccine, but when we learned about those results, we immediately had our data safety monitoring board, which is an independent board, go and review all the procedures, and the decision was made to continue the trial in the Philippines and elsewhere. We haven't seen any issues of that type. And really importantly, since we collected those baseline samples, we have the ability to know which kids are the ones who have never been exposed to dengue, and we can specifically assess safety in that population in real time. And so far, we haven't seen any safety signal. Now, the question of public perception and how do you address it, I mean, all we can do is develop a vaccine that's as safe and effective as possible, and continue to focus on how we can help prevent dengue in the world.
Alguma outra questão, alguma pergunta? Dr. Hensi, thank you very much for your presentation. Sim, nós teremos a conferência de abertura agora 2 horas, e será lá no auditório. Tá? Muito obrigado pela participação de todos.
Two minutes?
2 minutes.
Yeah.
I think we here in Rio, we have some delay from the schedule. I think we'll start.
I'm just glad that I finished on time.
Finish on time. Thank you very much for your presentation.
Thank you. Yeah, that's good questions.
Yeah, very interesting.
It's good that people are thinking about it.
Yes.
Solid scientific platform.
Yes.
Okay, so opening ceremony? Is that
Yes.
next
Auditorium.
one?
Pessoal pode mudar.
Thank you. Thank you.
Thank you very much for Valeu, falou, valeu, Felipe, obrigado mesmo. Valeu. Vamos continuar o contato. O Ramon que está entrando em contato com vocês?
Sim.
Então, continuar.